Xin kính chào quý vị, chào mừng quý vị đến với diễn đàn CEO trên kênh truyền hình VITV. Thưa quý vị, Việt Nam chúng ta đã đạt được nhiều thành tựu ấn tượng trong việc thực hiện một số mục tiêu thiên niên kỷ liên quan đến y tế. Tuy nhiên, việc thực hiện mục tiêu này vẫn gặp nhiều khó khăn khi mà năng lực cung cấp và mức độ bao phủ dịch vụ y tế còn hạn chế. Liên quan đến chủ đề này, trong tuần trước, diễn đàn CEO đã gặp gỡ và trò chuyện với CEO một công ty cung cấp dịch vụ liên quan đến bảo hiểm y tế và đóng góp của công ty đối với cộng đồng. Còn tiếp nối chủ đề, hôm nay chúng tôi mời đến trường quay VITV ông Steve Landman, CEO của Carego International, một công ty chuyên về ứng dụng công nghệ nhằm cải thiện chất lượng các dịch vụ y tế tại các nước đang phát triển. Trong bối cảnh ngành y tế nước ta đang thực hiện nhiều cải cách sâu rộng, thì sự tham gia của những công ty như Carego International đóng góp vào quá trình này như thế nào? Trước tiên, mời quý vị và khách mời của chương trình theo dõi clip sau.
Tại Việt Nam, nhiều đề án, chương trình và giải pháp cho vấn đề quá tải bệnh viện đã được nghiên cứu, triển khai trong những năm qua. Nhưng ở các bệnh viện tuyến trung ương tại Hà Nội và Hồ Chí Minh và một số bệnh viện tỉnh và thành phố khác, tình trạng quá tải vẫn diễn ra với mức độ ngày càng nặng nề. Người bệnh vẫn phải nằm giường ghép từ 2 đến 3 người một giường, thậm chí ngồi ngoài hành lang, trải chiếu nằm dưới đất để chữa bệnh. Dường như ngành y tế vẫn chưa tìm được liều thuốc hữu hiệu trong việc chữa căn bệnh quá tải. Theo thống kê của Bộ Y tế, tỷ lệ giường bệnh trong những năm qua có tăng nhưng không kịp so với tốc độ tăng dân số. Trong khoảng 10 năm vừa qua, tuyến trung ương chỉ có một số bệnh viện được xây mới hoặc cải tạo, sửa chữa và mở rộng. Như Viện Huyết học Truyền máu Trung ương, Bệnh viện Ca, Bệnh viện Đa khoa Trung ương Cần Thơ, Bệnh viện Trung ương Huế. Còn lại là đang xây dựng và mở rộng. Tại thành phố Hà Nội, hơn 50 năm qua mới chỉ xây dựng Bệnh viện Thanh Nhàn và Bệnh viện Ung Biếu. Số liệu của Bộ Y tế cho thấy năm 1999, tỷ lệ giường bệnh tính trên 1 vạn dân là 16,9 giường, năm 2010 là 20,6 giường và năm 2011 đạt 21 giường. Trong khi trung bình mỗi năm, dân số tại Việt Nam tăng khoảng hơn 1 triệu người. Và đồng thời, số người bệnh và các loại bệnh mới cũng gia tăng. Và nguyên nhân chính dẫn đến tình trạng quá tải vẫn là nguồn nhân lực. Cùng với đó là sự chênh lệch về chuyên môn, cơ sở vật chất, trang thiết bị giữa tuyến trung ương và tuyến y tế cơ sở trong nhiều năm nay vẫn chưa được giải quyết triệt để. Trong khi chờ Bộ Y tế có biện pháp mang tính dài hơi và đồng bộ nhằm giải quyết tình trạng quá tải, một số bệnh viện đang tự tìm cách giảm tải. Nhiều bệnh viện đã triển khai một số giải pháp đẩy mạnh ứng dụng các kỹ thuật chuyên sâu, kỹ thuật mới nhằm nâng cao chất lượng khám, điều trị, chuẩn hóa phác đồ điều trị, đa dạng hóa các loại hình khám chữa bệnh và tăng tỷ lệ giường bệnh, tăng cường kiểm soát nhiễm khuẩn bệnh viện, đẩy mạnh ứng dụng công nghệ thông tin trong khám, chữa bệnh, cải cách thủ tục hành chính và nâng cao năng lực cho tuyến dưới. Và để làm được điều này, cần có sự hỗ trợ về khoa học kỹ thuật cũng như nguồn lực từ nhiều tổ chức bên ngoài, các công ty cung cấp thiết bị cũng như các tổ chức tình nguyện. Năm 2008, Carego International, một tổ chức ứng dụng công nghệ chuyên cung ứng dịch vụ y tế chất lượng cao đã ra đời tại Mỹ, với sứ mệnh cải thiện dịch vụ chăm sóc sức khỏe cho những người không có điều kiện tiếp cận với các dịch vụ y tế chất lượng tốt. Công ty đã cung cấp dịch vụ cho nhiều nước đang phát triển và bước chân vào Việt Nam từ năm 2011. Các công nghệ mà công ty Carego cung ứng bao gồm các phần mềm khám bệnh từ xa, phần mềm theo dõi bệnh án từ xa, phòng khám di động và các thiết bị y tế khác. Với các công nghệ này, bệnh nhân không phải đi quá xa để khám bệnh mà vẫn được điều trị một cách tốt nhất. Các bác sĩ cũng không mất thời gian để tìm hiểu về quá trình khám chữa bệnh của bệnh nhân mà tập trung vào chuyên môn.
Mr. Landman, thank you for joining us today in our program about Talk with CEOs.
Thank you for having me.
Why did you invest in the healthcare sector, and why do you aim to develop or to operate your company in the developing countries?
I started Carego. I started the company 7 years ago to focus on the underdeveloped countries who needed healthcare delivery to be more efficient and more and to have more quality. I had taken a trip to Madagascar 8 years ago to do a technology project focused on bird flu. And when I got to Madagascar, I realized how poor healthcare was being delivered, and people just like you and myself whom deserved quality healthcare were not receiving it. And at that point, I resigned from the previous company that I started and decided to start this organization focused on providing healthcare to mainly the poorest people around the world.
Okay. So how many developing countries have you come and provide your technologies?
So this next January will be our 10th country, which is Congo, which is one of the poorest countries that we've operated in. Half of them are in Africa, half of them in Asia.
Okay.
Yeah, so many countries like India and Pakistan and Egypt and Indonesia and Vietnam and Philippines, and then the rest are in Africa, East Africa.
Okay. Can you share more how's the experience when working in other Asian countries?
I find the healthcare situation similar in many countries, but then you have many differences in many countries. Indonesia, for instance, is a very challenging place to work. There's many different hospitals and healthcare organizations. However, many of them don't cater to the low-income areas. So you find many middle-class and upper-class healthcare facilities, and people seem to have left out this population at the bottom of the income level. You find it very similar here in Vietnam as well, where the upper income levels and the middle class are taken care of much more than the people, for instance, in rural parts of Vietnam. So I find it very similar. From a healthcare perspective, I think the delivery of healthcare, the quality of the doctors are better in Vietnam than in other Asian countries I've been to, though.
How long have you been here in Vietnam to invest and operate?
Almost 2.5 years I've been working in Vietnam. I started in Ho Chi Minh, building 2 clinics in Ho Chi Minh City.
So from your experience in 2.5 years here in Vietnam, can you share your review or your remarks about our healthcare sector?
Sure. I think, again, while it's pretty progressive in its approach to delivering healthcare, I also see so many inefficiencies and challenges that are posed here in the healthcare industry in Vietnam. Some of the challenges are obviously overcrowding in the hospitals.
Okay.
There's other inefficiencies like the way that we treat people here in a lot of the hospitals in Vietnam. If you're sick, you end up going only to a hospital. There needs to be other facilities that we can have outside the hospital to reduce the burden to the hospital, and that way we don't have the overcrowding in the beds here. Again, I believe that most of the doctors and clinical staff in the hospitals that I work with and see are very passionate about their work. One of the transformations that I see going on in many other countries is that finally we put the patient at the center of healthcare and not the doctors. So I think that transformation also needs to happen here, where all the attention is focused on the patient, not on the money, not on the treatments, not on the notoriety, and that's what we hope to do with my company.
Okay, so we think that the biggest shortcomings in Vietnam's healthcare sector is that the overcrowding and not focusing on patients.
Yeah, and inefficiency, I think, in the workflow from the time that the patient enters a hospital or facility, what happens to that patient after they register and move on. I think there needs to be a lot of work on the workflow here.
So as foreign investors, what advantages and challenges that have you had when doing business here?
Sure. I think the biggest challenge is learning to navigate the environment here, learning to navigate government here, learning to understand the behaviors and the way that the doctors and administrators in hospitals think and behave. It's not like any other country I've seen before. There's so much pressure financially, and there's so much pressure for notoriety that, again, I think we forget about why the clinicians and the nurses and why they're doing their job, and it's to treat people and to make people better. And I think, again, hopefully if from some transformation we can change that behavior and thinking.
Okay, so that's the challenges.
One of the biggest.
So what about the advantages? I hope that you have some advantages here or working here.
Right. Again, I think some of the advantages is that people are willing, which is, right, willingness is one of the beginnings to getting change done. So that's a beautiful thing. I think we have a very educated healthcare sort of healthcare physicians and nurses. I think we have quality there and education.
Yeah.
I think the system just needs to be improved. So I think the fact that we have people that are willing to help people, and we have people who have gone through education around the world, France, the United States, other countries, and worked from a doctor's perspective. And I think we have great nursing schools here. I think it's not unsurmountable. I believe that we can make change here. It's just going to take some time.
So what is the role of applying the electronic technology software in the administrative management and examination as well as treatment here in the hospitals?
Right. That's a fantastic question. It's, for me, it's a very passionate issue for me. I think I've been here, again, 2.5 years. I've studied healthcare technology for 2.5 years and hospitals here for 2.5 years. Mm-hmm. I think technology, hands down, can make enormous change here in Vietnam and in healthcare. Not only in healthcare, but in many other areas around healthcare, even supply chain and other things. Yeah. Number one, I believe healthcare technology will improve efficiency. So we know you've been here before. We know who you are. We know what medications you have. We know, why you've been here before. We know your insurance. We know everything about you. So every time you come, we know about you. So we don't have to collect all this data. Yeah. So number one, it creates efficiencies. You don't have to keep on signing in. You don't have to keep on registering new things about you. You flow through the registration process and then get to consultation much faster. And what's fantastic about technology when you get to consultation, the nurse can do her job. The nurse collects your vitals, your weight, your height, your blood pressure. That all gets entered into the system. So by the time you get to the doctor sees, oh, you have very high blood pressure, you have this fever, you're this weight, you're overweight, underweight, whatever you may be. So the doctor actually can do a much more thorough examination of the symptoms that you're experiencing and diagnose you much easier. The other really beautiful thing I think about technology is that technology allows you to automate the decision. We call it decision support. So based on your symptoms, the system actually says, oh, this person must have this illness. So if you have a headache and you have a fever and you have pain in your abdomen, the system says, oh, this looks like malaria. So here's what you need to do to treat malaria. You need to give this test, you need to give this test, and you need to prescribe this drug. And what's amazing about that is you create this quality and standard of care across the board so that we treat people all the same way because they all have the same symptoms. And then they all, based on all these symptoms, we collect all this data about certain illness. And if we have this data about certain illness, we can actually start creating drugs that are targeted to these illnesses and get rid of these illnesses. And if you end up in the hospital, we know what bed you're in. We're not trying to find you. And when it's time for your drugs, the nurse gets an alert that it's time for your drugs to be administered. So all this incredible information that we get as a result of systems allows us, number one, to be more efficient in our treatment, but more importantly, we're treating people the way they should be treated with quality.
Okay. If we want to say that the information that we should manage in the computer UAS technologies, of course we have kind of the software to manage the work.
Yeah. You absolutely do, and it's very old technology, and it's technology that, and again, having analyzed a lot of the hospitals and watched them use the systems, they're only using about 20% of the system.
So you mean the new technology will improve that?
Absolutely. Number one, because the old technology is, one of the issues around healthcare technologies is that people build technologies and make people work around technologies. What we've done with our technologies is we built technology that fits around the way people work. So we don't make the technology be an intrusion to doing your job. We make it an add-on to make it easy. So some of the older technologies that I've experienced here, they're not being used honestly. So when you ask me a question about the administration and the financial viability, from a management standpoint, you can't see because you're not getting the data you need to be able to make those business decisions and see how your hospital's doing. With the technology we built, again, making it easier, if I'm a nurse, all I see is the input that I have to use. I don't need to see anything else. If I'm in registration, I see that and payment and insurance. But that allows the data that needs to be put into the system to be put into the system so that we can report and do business intelligence and analytics on the outside.
That's what I can understand about the technology, the new technology. But do you think that in some underdeveloped areas in Vietnam, it's not easy to apply such technology in the computers system in the local hospitals?
So if I can do it in the middle of the bush in Congo, I'm absolutely sure that we can do it in rural parts of Vietnam. So what we've done for people in more rural, less sophisticated areas is we've actually built similar technology. We call it light products. So they're a little bit less functionality on Android tablets, and it allows them to enter the data online and offline because connectivity becomes an issue. Internet connectivity becomes an issue in some places.
Yeah.
Also power. So we use low power, low bandwidth products like Android tablets that allow them to do very simple data input. And in turn, we get some of that same rich data available to our healthcare system as well. So if I can do it in Congo and I can do it in Rwanda, I'm sure we can do it here in Vietnam.
Okay, great. I know that in some developed countries, you have a kind of family doctors who will collect all information and is the first person to examine and to treat the patients. So that's kind of family doctors who will receive and manage all the information. It's not the hospitals, right?
Exactly, yeah. Not only in other countries is it family doctors, it's also nurses.
Okay.
Sometimes you'll go to clinics in Kenya. We have 70 clinics in Kenya, whereas nurses are the only run them. There's no doctors. And there's also clinical officers, which are not doctors as well, running those clinics as well. So again, I mean, there's very, very simple ways using technology, telemedicine, for instance, in order to treat people without having expensive, busy doctors on sites all the time.
The other service that your company provides is a consultation. Talk more about this.
Yeah. So telemedicine and teleconsultation, we're hearing a lot about that in Vietnam now. People are talking about it. I haven't seen a lot of it implemented yet. We actually built technology that allows us to do somewhat of a video conference. Is probably the biggest way easiest way to explain what telemedicine is. Telemedicine is a very general term, by the way. Telemedicine can be a consultation from face-to-face over video.
Yeah.
It could be sharing medical records or x-rays or EKGs, heartgrams, using video conferencing. You can also do a lot of what we call CME, or continuing medical education. We can actually do forums, so if you're a doctor in a rural area or nurses in rural areas, we can actually do teaching as well, remotely using video conferencing.
Yeah.
The great thing about the technology that we built is that we only require 2G networks. We're on 3G here, but we actually run our video conferencing on 2G, even on something as small as a mobile phone. Some of the other really great medical devices that we've brought to the country is wireless or Bluetooth blood pressure cuffs and eye examinations that latch onto or clip onto a cell phone. And that same data can be shared through a teleconsultation or telemedicine examination.
So have you had any cooperation with the hospital to implement the consultation programs here in Vietnam?
Yes, we're working with a few hospitals here in Vietnam to do that. One of the projects we hope to launch beginning of next year is actually utilizes a few of our technology and products. One is telemedicine. The other one is we call electronic medical record, or EMR. And also some of the mobile clinics that we're creating that I believe we'll talk about later on. But our plan is to put a mobile clinic run by a nurse out in a rural place in one of the provinces outside of Hanoi, where we'll do teleconsultations. We'll focus mainly on children and have nurses treat children in rural areas using our mobile clinics and our technologies.
Okay. So that kind of consultation will help to improve the fact that our hospital in Vietnam are quite crowded, right?
Definitely one issue, but the other issue that I find in every country that we work in is that there's no hospitals out in some of the rural areas and the mountainous areas and the more remote areas. So people are spending a long time to travel, and it's expensive and it's time consuming to go to a hospital. And then if you're really sick, you have to come to Hanoi or in one of the larger hospitals in one of the provinces to get treated. it becomes expensive. In many cases, I see people much sicker by the time they get to the hospitals just from the travel. So conceptually, what we want to do is bring healthcare to people. You know, again, let's not wait and have them have to come to us, because what I also find in developing countries is people wait until it's too late. We don't want to do that, especially with children. You know, under 5, the under 5 population of infant mortality, we call it, is very high in these countries. So we need to bring healthcare to the people, and this is one way to do it. Yes, it'll alleviate some of the overcrowding in the hospital, but more importantly, we become the front line of defense by getting the healthcare systems out to them.
Okay, but here just appears to problems. I think first of all is that if the people, the patients in remote areas have such kind of consultation from the doctors, maybe they do not have some kind of the medicines and treatment that is appropriate to treat them as that remote area.
You're awesome. That's a great question, a great issue.
Let me just finish one. Okay. And the second problem is that once again is that the facilities, how to say, powers, if they cannot connect to the doctors to have such kind of consultation, it's also a problem.
Right.
As we can implement our wish to have them, right?
Because we know most of the data of the 20 most common illnesses for children, we can make sure that those facilities have drugs to treat those. Mm-hmm. So again, we have 70 clinics throughout Kenya focused only on children. Mm-hmm. And we know that there's, in Kenya, for instance, we know there's 10 illnesses that children always get, such as malaria and malnutrition and diarrheal illness, and we know those top 4 are the top 4. So we always keep our clinics there stocked with those medicines. We would do the same thing here. We know what the top illnesses are, focus on children. The other great thing about technology is that we know when there's low stock of drugs, because in our inventory management we can say, hey, when our drug level gets to 10 malaria pills or medicines for treatment, we need to make sure we have more out there. So that's number one. Why, yes, there's very low power, there's very low internet connectivity. I haven't found a place in Vietnam or even in the middle of Africa where we can't get some kind of 2G or 3G network at some point, maybe not consistently. So what we do is build technologies that allow you to work offline, and when you have online capability, it automatically syncs the technology to the database so we can see what's going on. Mm-hmm. From a power perspective, the beautiful thing is we have these little solar mats, these little panels for solar that allow us to charge devices. But again, Android tablets don't require much power.
Okay.
Also, our mobile clinics are self-contained, so we can use solar power generator as well.
So have you had such kind of cooperation with the local hospitals or say the administration to improve to implement the projects?
So we're working on that right now. So yes, I'm getting great cooperation. Are we close to getting the project kicked off? Not yet. We'll be. I'm hoping by March of next year we'll actually be able to implement and deploy our first project around pediatric healthcare. Yes.
CEO Steve Landman, 46 tuổi, người Mỹ, là một người có tình cảm sâu sắc với các hoàn cảnh khó khăn trong xã hội. Không cầm lòng được trước hình ảnh những đứa trẻ nghèo đói, mắc các chứng bệnh thường gặp, nhưng lại không nhận được sự điều trị thích hợp bởi hoàn cảnh khó khăn không cho phép các em tiếp cận với dịch vụ y tế. Ông Landman đã tìm hiểu và phát triển các ứng dụng cho phép khám chữa bệnh từ xa, và đặc biệt là phòng khám di động có thể đưa đến các vùng sâu vùng xa. Phòng khám di động không còn xa lạ trên thế giới, được sử dụng rộng khắp nhiều tính linh hoạt và tiện dụng. Theo lời ông Landman, những phòng khám này của ông đã được đưa đến nhiều nơi trên thế giới. Quốc gia đầu tiên mà ông phát triển dịch vụ này là Madagascar, tiếp đó là các nước như Kenya, Uganda, Congo, tại châu Phi và một số nước châu Á như Philippines, Indonesia, Ấn Độ. Đây đều là các nước đang phát triển, cơ sở y tế còn nhiều thiếu sót và chưa thể cung cấp cho các vùng khó khăn. Những phòng khám di động của ông Landman thường được chuyên chở bằng thuyền dọc sông Amazon để hỗ trợ khám chữa bệnh cho những người bản địa. Thường được trực thăng cẩu lên vùng mỏ tại Congo hỗ trợ trẻ em nghèo đói mắc bệnh. Những phòng khám di động này được hình thành từ những chiếc container chở hàng, Qua quá trình thiết kế và lắp ráp, chúng trở thành những phòng khám tiện lợi. Tại Việt Nam, Carego đang sản xuất những phòng khám kiểu này ở Hà Nội thông qua công ty Hưng Đạo Container và được xuất sang nhiều nước châu Phi. Mô hình cơ sở của phòng khám này bao gồm ánh sáng, nguồn điện, cách nhiệt và được thiết kế để đáp ứng bất kỳ nhu cầu nào để chăm sóc sức khỏe. Từ các thiết bị như đông lạnh, giường khám, bàn lắp ghép, máy phát điện và tấm pin năng lượng mặt trời sử dụng trong chẩn đoán, trao đổi thông tin, IT và hệ thống nước, Carego có thể xây dựng các phòng khám theo tiêu chuẩn và yêu cầu quốc tế.
Có nghĩa như này, những cái công mà bên tôi sản xuất cho bên Carego thì là những cái công mà phải đạt tiêu chuẩn ISO để có thể vận chuyển đường biển được. Vì là cái yêu cầu họ rất cao và họ yêu cầu là vận chuyển sang châu Phi hoặc có thể một số nước mà họ yêu cầu. Về cái chất lượng thì về nội thất của họ yêu cầu là phải đạt theo cái kỹ thuật của Mỹ và bên tôi phải sản xuất theo đúng cái tiêu chuẩn đó. Ngoài ra thì những cái công mà sản xuất cho bên Carego, bên tôi phải đảm bảo là cái vấn đề về chất lượng ít nhất là còn trên 80% để có thể đảm bảo vấn đề vận chuyển đường biển. Về cái kỹ thuật của phòng khám thì phải đảm bảo tiêu chuẩn, ví dụ như là về chống cháy này, rồi về hệ thống điện là phải đảm bảo an toàn, dây điện là phải loại tốt để không ảnh hưởng đến vấn đề chập cháy. Rồi vỏ container cũng phải yêu cầu là sơn các loại sơn mà chống cách nhiệt để làm giảm cái độ nóng của container. Chúng tôi sử dụng các vật liệu ví dụ như là cái sàn thì có thể sử dụng bằng xi măng chống cháy. Về phần vách thì phải đảm bảo làm sao mà có thể vệ sinh được sạch sẽ. Còn trong một cái công thiết bị y tế như thế là phải đảm bảo ví dụ như có một cái giường để cho bệnh nhân làm để khám chữa bệnh, rồi có một chỗ để có thể rửa tay để cái vấn đề sát khuẩn, và có bình nước ở trên để cấp cho hệ thống nước trong đó và có phần thải để đảm bảo an toàn vệ sinh. Ngoài ra thì có một buồng nhỏ để làm một cái gọi là để tủ thuốc của bên dược, thì sẽ trong đó sẽ có đầy đủ các cái thiết bị y tế mà khi cần là sẽ có.
Carego đến Việt Nam không lâu và mới ở bước đặt nền móng sơ khai, nhưng ông Landman hy vọng sẽ nhanh chóng giúp đỡ được các trẻ em nghèo khám và chữa bệnh. Ông tâm sự, Việt Nam là một quốc gia đông dân, các bệnh viện luôn ở trong tình trạng quá tải. Ông hy vọng sẽ cải thiện điều này, góp phần nhỏ vào công cuộc cải cách ngành y tế tại Việt Nam. Với sự hỗ trợ từ nhiều tổ chức chính phủ, phi chính phủ và các tổ chức tình nguyện từ nhiều nước như Mỹ, châu Âu, CEO Steve Landman hiện đang hoạt động rộng khắp trên thế giới để hỗ trợ nhân đạo, cho phép khám chữa bệnh với chi phí rất thấp, và Việt Nam sẽ là nơi ông dừng chân trong những năm tới.
You're talking about the mobile clinics, and please talk more about that. How do you have this kind of idea to build up the mobile clinics for people?
Right. So again, referring back to my opportunity in Madagascar, where I spent Madagascar in 1998, helping them with bird flu, avian influenza. I was asked to go to Madagascar to create a technology to collect data on bird flu on handheld devices. And when I was there in Madagascar, I noticed how terrible healthcare delivery was, that there was no facilities for them to deliver healthcare, that they had had these shipments of vaccinations and immunizations sent to them. There was no refrigerator to put them in, so they all went bad, thousands and thousands of dollars of them. So I resigned from the company that I founded and decided that it was time to start another company, and that's why I started this company. And initially I said, let's focus on building facilities, locations where we can deliver healthcare in a clean, air-conditioned facility that allows us to have vaccinations and other medical devices in order to do the examinations and tests. And so I thought hard and deeply about it, and I had done telecommunication centers in containers, and decided let's build healthcare clinics in these containers as well. So today I have them all over the world. The first ones I built were actually tested by the United States Army, and they dropped them out of airplanes with parachutes so that we could see the durability of them and see if we could make all the instruments inside be able to stay in place and not get damaged. And then my first deployment was 2 of them on boats that float down the Amazon River in Ecuador, and they treat all the villagers along the banks of the river, the Amazon River in Ecuador. And today they're all over in many countries. I actually build the bulk of our Carego container clinics here in Vietnam, actually.
How are the kind of mobile clinics equipped? You mean you have the fridge and air conditioners and what else?
Yeah, so what's amazing about them is we can do anything with them. So depending on what requirements are for the facility, we can customize them anyway and design them anyway. So we start by gathering requirements of what is needed. We do CAD drawings, computer automated design drawings. We do artist renditions or animated renditions of what they look like, even to the point where you can actually walk into one, you know, in a virtual world and see where everything is and lay them out. So they come equipped with anything. So refrigeration, lights, examination bed, medical devices, anything that you need, you would have. And I find most people can't tell the difference between walking into a regular doctor's office or walking in a container office.
So how long have you put your ideas into practice in other countries?
I sent my first clinic from the United States in 2007. So it's been almost 7 years now. In May it'll be 7 years I sent my first one. I believe they're in probably 12 or 13 countries now. Not only clinics, but laboratories and morgues. So we send them for disaster, like in Japan during the tsunami. They're sent there because we have all of these, unfortunately, these bodies that are decomposing. So it allows you freezer spaces to actually put in bodies that are decomposing. So there's many applications for them. I just came back from I was explaining earlier, one of the poorest countries I've ever been to. And it was honestly one of the saddest places I've been to, the Congo. The Congo is war-torn. I've never seen malnutrition like that. I've never seen water, undrinkable water, and foods that are uneatable. And what's amazing is that we can actually bring healthcare to the communities that have nothing. And what I think is really important is that we make the healthcare facility part of the community, make it community-owned, make them proud of it, so that they get people to come to these container clinics. So the first ones will open in January, the end of January in Congo, or in very, very, very poor, very, very remote areas where there's nothing, there's no healthcare. And we just hired our first doctor who will run the first clinic and eventually oversee. Our plan is 100 clinics in Congo over the next 3 years, of the container clinics. Again, they're being manufactured here and shipped all the way to Congo, so Vietnam gets to be part of helping Congo. And we have a nurse running it. We'll offer them food and nutrition and medical care and clean water at these facilities. So we're hoping that we can impact, thousands of lives in the first year and then tens of thousands of lives going forward.
How many patients come to the clinics every week or month?
Yeah. So in Kenya, we treat about 90,000 people per month right now. In Kenya, we have about 13 clinics in Kenya. So each clinic is seeing somewhere, quite a bit of people per month and per day. They're burdened with people, again, because there's no quality health care. I believe in that it doesn't matter who you are, where you come from, you deserve quality health care. You're a human being, so you deserve that. So we see a lot of people. Our projections in Congo is that we'll see about 1,000 people per clinic per month after 3 months, which actually will start ramping up to many, many more people after that.
Okay.
But we also make sure that people pay for their health care. Not very much, but I believe that people need to invest in their health care, otherwise they won't take care of themselves. So while we are social-focused, social impact organization, corporation, I believe that a sustainable model is only a for-profit model, but we make people pay very little in order to stay sustainable.
How did you raise the fund to run these clinics?
Yeah, so my experience in starting the 13 companies I've started is by raising financing or selling equity in our company. And that's how I did that with this company. The same that I did with every other company, I used the same model for this company. Most of my investors realize that we're a social impact company. So there's this category called double bottom line return. So normally in a corporation you have return on investment, one bottom line return. In social impact, you have two, one being financial return, but impact to humanity and society is the second one. So you have this balance of return on social impact and social capital, but at the same time you're having financial impact and financial return as well. It's a kind of a new breed, and you have to find a good balance for your investors between, the money return plus what you're doing good in the world.
So initially, it is a kind of a charity activity, right? Initially,
I think almost every company is a charity initiative initially because you're not making money in the beginning. But I lead with the social focus. Yes, if we're not treating people and improving the quality of lives of people, we wouldn't be doing it. And I also believe that by doing good for people, the financial return comes as well.
About the clinics, did you receive the feedbacks from the doctors, from local doctors and nurses and patients?
Yeah, we find a lot actually. Again, especially in areas where there's nothing, right, and there's not long lines, you find they're so grateful and so appreciative. The doctors find them as easy to work in or even easier because everything's right. They don't have to travel far within a facility to get what they need to do their job. It's all right there just by turning around within the facility.
Yeah.
Patients love it. Patients think it's incredible that I'm in the middle of, the Masai Mara where the tribal people are in Africa, and there's a clinic there, and I can walk in, and there's air conditioning, and the drugs I need, and the instruments that the doctor needs are all there. People are very appreciative.
So you have the same projects here in Vietnam, right? In the future, what is the challenge and difficulties, and as well as the advantages, and the pros and cons when implemented the projects here in Vietnam?
Right. So challenges first. I think challenges number one is changing the way people think. It's always the hardest job, I think. Number one, we have these facilities out in the middle of rural areas. They're in containers. How do we get people to go there? Who's going to regulate them? Who's going to pay for it? Who's going to manage it? Where's the staff going to come from? Those are some of the challenges that we'll, are initially trying to get over. I think people are fearful of what that looks like. Are we, the doctors, are we going to lose our jobs if we let nurses run them? Are we going to have a connection to them where we actually know that people are getting treated properly and by the MOH guidelines, for instance? Those are some of the challenges. Obviously, who's going to fund it is a big issue. We're willing to fund part of it. It's finding those partners. We've found some other partners that are willing. I actually believe that government should get involved, or provincial government should get involved, because I believe that we can actually improve the healthcare systems in these areas. We'll see if that happens. Those are some of the challenges. Budgets are obviously tight, and people want control, so those are some of the political, economic issues you have. I think from a benefits perspective, personally, I can't think of anything that wouldn't be a benefit, because again, we are going to be able to treat so many more people. We'll be able to create so many more jobs. We'll be able to see the benefits of the treatments and procedures and the drugs we're administering to see if we're improving the healthcare baselines of people around the world. There's so many benefits. The model that we've used in Africa is that we as a company don't own the clinics per se. We actually franchise them like a McDonald's or Starbucks, that we let nurses own their own business, and we support them to run their own business, and we show them how how to be business owners, and we support them in that. And in turn, those communities start to prosper, that jobs start get created, and people start making money, and they start spending money in their communities, and the whole community prospers. So from a benefit standpoint, I haven't seen it not be a benefit anywhere I've worked.
Once again, there are also the headwinds for when implementing these projects, because the container clinics it's quite difficult to transport them to the areas.
In some areas, yeah, as long as you have a truck, in most places we can get them. In some of the African countries, we've had to find large cranes to take them off and move them and place them there. From a transportation and truck and boat, not so difficult. It's sometimes getting them off the trucks. In some cases, we don't even take them off the trucks. We just build stairs into them. So there's different ways that we can actually get around some of the transportation issues. I haven't found a place in the world that we haven't been able to get a clinic to yet.
You call it the mobile clinic, so it means that you just put it there, or once again you will move it again from localities?
Right. That's a great question. So I call them semi-permanent. And semi-permanent meaning that we can put them in one location, we can pick them up and take them somewhere else. One of the biggest issues around being successful in the business aspect of healthcare delivery is location. So if you put a container clinic in a location, you're finding people aren't coming to it. The great thing about it is we can pick it up and move it to another location where there's more people coming to it. So we call them semi-permanent. Or we've also built mobile ones. We actually have them on big trucks that we pull around all over all the time. They're always mobile, not permanent at all.
Do you receive any offers to buy the clinics in all over the world?
Yes, we're in the process of building 12 of them that will be in Rwanda, that the United Nations is purchasing for Rwanda for refugee camps. There's also some being built for the African Humanitarian Association, also going to Rwanda, some going to Congo, some going to Haiti as well. Yeah, Haiti from the disaster of the earthquake and the hurricanes. There's some going to Haiti next year. Even we're building some in Vietnam for the United States for disaster, for hurricanes and other tornadoes. Totally lost the word. Tornadoes for the United States as well. So yeah, all over the world, I think there's opportunities for container clinics.
So it's pros to have worked efficiently, right?
Absolutely, yes, absolutely.
Okay, so Steve, thank you for your sharing with us today in our program, and I hope that you and the company Carego International will develop more in the future and contribute more to our society as well as in other societies in the world.
Thanks, I hope so too. I'm really excited about the opportunities in Vietnam. Thank you.
Vâng, thưa quý vị, Việt Nam đang trải qua công cuộc cải cách kinh tế xã hội quan trọng, trong đó cải cách y tế là một trong những yêu cầu cấp thiết. Hy vọng rằng sự tham gia của những công ty như Carego International sẽ cùng đóng góp vào quá trình cải cách này, nâng cao chất lượng chăm sóc y tế đến mọi vùng miền của đất nước ta. Và chúng tôi cũng xin chân thành cảm ơn quý vị khán giả đã quan tâm theo dõi chương trình. Hẹn gặp lại quý vị trong các chương trình sau.